And so for today, I'm excited to have Josiah, Doug, and Jamie here to talk about 4 successes in public health and lessons for cybersecurity. And why don't we jump in, give them the stage, and we can put questions into the chat and then bring them up verbally at the end. And just as an FYI for everyone, this is being recorded, so we'll all put our professional hats on just a little bit. Who would like to take it away?
I'm going to go ahead and get started. Thanks, Adam. Thanks for the introduction. Thanks for the invitation to come chat. This is really, we're looking forward to our conversation. We don't have an hour's worth of material to just present as work already done. These are things we've been thinking about and really welcome feedback, pushing us, questioning like things that you have thought about. Hopefully this inspires some conversation and maybe some future work. I'm going to go ahead and share my screen because we have a couple of slides just to kind of keep us honest and moving forward. You've heard a little bit about the introduction in the chats we've been having here in the last couple of minutes. We are really interested in learning things from public health that might be applied in cybersecurity. This isn't about making public health safer in cybersecurity. That is a different need that we have not been thinking about. But I think lots of us have thought about how one domain can teach us things in another domain. So when I was doing my PhD, I was studying forensics, but digital forensics can learn a lot from blood and guts forensics. That domain has been around for much longer. I learned things from anthropology that applied to digital forensics. So I think this is a really interesting area of interest for at least Doug and Jamie and I. If it is the wrong path, we would like some correction. And honestly, I will say up front that I am a little bit cautious about analogies. I wrote a book that came out this year about myths and misconceptions in cybersecurity, and actually wrote several chapters about the cautions about what can go wrong if we misuse myths, analogies and metaphors. So I don't want to abuse that, but I think in this case, there are things that we can learn because there are commonalities between the two fields, and we'll get into that a little bit. So you heard a little bit about us a few minutes ago. We come from computer science and medicine and economics, and we, Jamie, Doug, and I have really enjoyed this collaboration. I'm sure you all have multidisciplinary collaborations as well. I regret that I never took economics in school, and I regret I never took psychology in school as a computer scientist, because I think the only reason we have computers is because of people, and I should understand people better than I really do. But that has become a research interest of mine. My day job is not as a researcher, but as a practitioner. I help direct the technical work at the National Security Agency for things like cloud computing, zero trust, cross-domain solutions, emerging technologies like AI, pretty broad spectrum. Doug, do you want to say any more about your background and introduction that hasn't been said already?
No, I think that I pretty much did it.
And Jamie, anything for you?
Similar to what I said earlier, I have a degree in mathematics, but I've worked in computer science, cybersecurity, software design, and engineering. I've been a little all over the place for about 30 years now.
And like you heard, our interests as a group have sort of wandered a little bit. When we started, we did a Black Hat talk a couple of years ago about action bias, which we also felt was this intersection of economics and cybersecurity and sort of multidisciplinary. And yeah, I think Doug mentioned I don't really recall how we came into thinking about public health as its own sort of domain, but we've learned a lot in our thinking, and we want to talk a little bit about things that have come into our minds in the last at least 6 months or so. I will give a disclaimer that these are our own personal thoughts. They don't necessarily represent any of our employers, including the government. I am going to hand it off to Doug, who knows much more than me about healthcare, and let him talk a little bit about that.
Okay. Thanks, Josiah. So maybe I guess I should make a little bit of more of an introduction and some qualifiers. My background is economics. I wandered into health economics now almost 50 years ago when I was writing a dissertation at the University of Wisconsin, and it seemed to be it ended up being in health economics, which almost didn't exist back then, but has grown. And I've been at Hopkins for 20 years. For the first 10, 13 of those, I was in the business school, and then moved over to the School of Public Health about 10 years ago. So I've kind of gained my knowledge of public health through osmosis by being there, as opposed to any formal training. So we've got that. Nevertheless, I mean, you have to start out with, okay, what is public health? And we have the classic definition by Winslow, now almost 100 years ago. It's the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts, and so on. And so we wanted to we were thinking, well, there might be some good analogies, maybe useful analogies of public health for cybersecurity. So that's why we started to do what we were doing. And the way we sort of went about it is identified four successes in public health, and then to see, well, how would those successes translate over to cybersecurity? So we wanted to go through those. And just to let you know, I'm going to talk about what the successes are, and then Jamie's going to jump in on what that might mean for cybersecurity. So Josiah, next slide. Oh, there we go. Oh, I forgot that one. So part of what led us to this was what we were thinking about the commonalities between public health and cyber. Both of them protect people from threats. I mean, you can see those up there. You all know what those are. That's what you all are doing in your work. And so there was enough commonalities that would seem to make sense that there's enough of a Venn diagram intersection that it's worth it to make these kinds of explorations, and we'll see where we go. Okay, next. So we start with the most famous, the most dramatic, and probably the least representative example of a success in public health, and that's John Snow and the Broad Street pump. That 19th century London, replete with outbreaks of disease. At that point, the prevailing paradigm in medicine was miasma. It's just this atmosphere that's causing these things. And in 1854, there was an outbreak of cholera in Soho. And Dr. Snow, who was an obstetrician, noted that, here's the quote, within 250 yards of the spot where Cambridge Street joins Broad Street, there were upwards of 500 fatal attacks of cholera in 10 days. And he had what was then the unusual hypothesis that it was the well from which the residents were drawing the water that was the cause. Now, this was hard to convince people of, that this was it. But he convinced town officials to remove the well's pump handle for a brief period of time. It was to be temporary. But what happened was that the outbreak subsided almost immediately. And this was a wonderful success. Every Public Health 101 class points it out. And because it was so dramatic, and it was, if you will, a magic bullet. It's a magic bullet because it was a single dramatic intervention. It didn't take much. You do something once, and then things happen. But as people in public health have found, yeah, there can be magic bullets, but they are few and far between. They're dramatic, they're exciting, but unfortunately, they may rarely provide a full solution. So there we have it. Success number one, a magic bullet of the Broad Street water pump. Jamie, take it from there.
I will do my best to follow on, Doug. And so for all of these lessons for cybersecurity slides, let me preempt with all of them and say, these are not revolutionary thoughts or evolutionary thoughts that we think the cyber community hasn't come up with before, but these are examples that are easily relatable in terms of sharing with others that most people will understand this, whether they're cybersecurity professionals, health professionals, or I might even be able to get my mom to understand a few of these, right? So in terms of a silver bullet, which of course doesn't feed the belt on a machine gun, right? It takes care of a single instance or a small set of instances and it fixes a current spot, but it's not going to represent a global answer. And some examples that we have are we've already got well-documented cases of if we know something has been infected or if we know something is suspect, how to quarantine it, how to put it in an air gap system and conduct forensics on it or check and make sure that it's safe before releasing it back out into the population. There are certainly examples where admins can do URL defanging or other types of mitigations within your own system to prevent your users from visiting or accessing already known blacklisted sites, which would be the equivalent of the infected pump. The problem, of course, being that if I have to rely on the admins or the local systems to do it, that's removing the pump pump handle for my users, but it doesn't remove the pump handle from all the users. It doesn't get rid of the infectious site. The pump handle didn't remove the infected water. It removed people being able to access it in that one location. And the last one example here, whether it's juice jacking or power jacking, whatever you like to call it, there are actually products you can go buy on Amazon. I know we said we were going to watch the language and recording, but the techies at work actually call them cable condoms so that they can plug in their phone at the airport and not worry about whether or not somebody has recently sat at that Southwest terminal bench with all the nice power plugs for you to share with. There have been historical examples already of battery chargers already coming preloaded with viruses on them. And so whether it's supply chain risk or otherwise, there are ways to help your user ensure that their device has no pump handle. I think we go to the next example.
Okay, back to me. Okay, success number two in public health. Again, everybody knows about this, the polio vaccine. And now we're getting closer to sort of the real guts of public health. It's a magic bullet, but after years and years of research and testing and finally distribution. As we all know, polio affected humans for thousands of years, but it was really not considered to be a distinct condition until the mid-19th century. By the mid-20th century, 500,000 people worldwide were killed or paralyzed by the virus every year. And in 1955, Jonas Salk and his team inactivated polio vaccine. A worldwide effort was undertaken to administer the new vaccine. By 1957, annual cases in the US had dropped from 58,000 to 5,600. And by 1961, only 161 cases were reported in the US. Worldwide distribution took much longer, but eventually annual cases dropped from 350,000 in 1988 to about 6 in 2021. This was again, it was a magic bullet, but it was a magic bullet much different than the pump handle because it required years and years of research and testing. And as Jamie kind of pointed out, for the in contrast with the pump handle, it really tried to find the etiology, to get down to the core of what was causing polio. At the same time, it wasn't like how it was different from the pump handle is that it took much more than the pump handle. Even after the research and testing, it has required extensive communication and distribution system. And even today, there are still people who are getting polio, mostly in North Asia. And the effort to eradicate polio from the face of the earth has not yet been achieved. So with that, what Jamie, what would be the analogies with cybersecurity?
So much like polio has not been eradicated, I guarantee we can find Windows 95 boxes still operating somewhere across the web space. And so this is more of an approach of a mitigation, a counter was developed, it was advertised, supply chain issues existed, but in the end, it's both a behavioral issue of are people willing to get the vaccine and how far can we spread it, and it's a logistics issue. And so since we can't eradicate all threats, the question then becomes how do we minimize them after existence? And so this is where we continue education campaigns. This is where we advertise after the fact. This is where the software updating and patches, not only the sharing of information and the automatic dissemination, and bless Microsoft for some of the things they do, the automatic, it's opt-in by default. So most of us don't know that we're patching nightly because Microsoft has hidden it from us, which helps. And so it's both continued awareness and campaigns, but it's also improvement of the underlying infrastructure that takes care of much of this for you, so that only the handful or the few are going to be left vulnerable to the known problems that exist. And now I'm feeling really bad that Doug has to talk a lot more than I usually end up talking. So feel free to fire some questions on my slide, and then we'll balance out Doug's time and give his voice a break.
Okay, third, smallpox. And smallpox is the eradication of smallpox is probably the singular global success of public health. Now, as with polio, smallpox has been around for thousands of years, and it has killed thousands and hundreds of thousands and millions of people for thousands of years. But as early as 200 BC, there was an idea that maybe we could do something about it, and healthy people were giving small sections of smallpox sores to ward off the disease. In effect, a proto-vaccine. But the first true vaccine wasn't developed until 1796 by Edward Jenner. This is classic public health history. And so we had the vaccine since 1796. But even so, unlike polio, we had a vaccine, but 2 million people a year were still dying of smallpox 100 years later. In 1959, the World Health Organization announced a plan to completely eradicate smallpox from the face of the earth, the first time that such a thing would be possible. But it wasn't until 1980 that the program led by D.A. Henderson, who later was the dean of the School of Public Health at Hopkins, succeeded in completely eradicating smallpox. And it was at the time the only disease that has been eradicated. There has since been one more. The public health officials are trying to make polio the third, but with not very much success. And before I hand it over to Jamie to talk about the analogies with smallpox, D.A. Henderson had this wonderful quote, and that was, nobody ever thanks him today. Well, before he died, when he was alive, no one ever comes up and thanks me for not getting smallpox, because smallpox was eradicated. So after 1980, no one knew from smallpox. But it's one of those great successes where, because nothing happened, that's a success. So with that, Jamie.
So I would really like to give you an example that we fully eradicated cyber vulnerability anywhere in the history of humankind. I'm not sure that I could, and even if I did, I'm not sure it would hold up another year because someone would take it as a challenge. I will say that the way that we've gone about as a culture or as a community with the thought of eradication is that the baseline systems and tools that we all function on have been improved over time. I don't think you'll ever see something akin to the original Morris worm be as successful as it was, because servers just aren't that open and unlocked as they were back in the day that facilitated that happening, right? The basic building blocks of programming languages themselves are now better to help prevent system or buffer overflow attacks. I can remember teaching people how to implement buffer overflow attacks in C and a couple other languages just 25 years ago. But even today, the basic building blocks we give them and the functions and the tools and the subroutines that are in the libraries that we point them to have been built to help mitigate those threats. And so the software, the hardware, the servers themselves are all being built at a higher standard, so that now it's not the 30-year-old infection vectors we're looking at, it's the current infection vectors we're looking at. And so we may never see true eradication. The concepts are still out there, but the actual tools themselves lose any kind of fertile ground that was still remaining that they might be able to grab hold in.
Great. And then our last example is the campaign to reduce cigarette smoking. You know, for decades, long been suspected that cigarette smoking was related to disease incidents like cancer and heart disease. The scientific evidence was sufficient in the 1950s to justify public health campaigns, but those really didn't take. What was the catalyst, though, was the 1964 Surgeon General's report on smoking and health. It came at a time when events were right. People were thinking more about their health. They were open to such things, and the report really catalyzed public opinion and government action. And so by 1969, cigarette ads in the United States were banned on TV and radio. In 1990, smoking was banned on all U.S. domestic airlines, and so forth. And by 2022, there were 28 states in the United States that banned smoking in bars, restaurants, and work sites. So, I mean, we've had that. And as a result, smoking rates have declined since 1965 from about 42% to 14%. Now, the thing there is, so what happened? I mean, was it that people read these reports and said, "Oh, golly, I guess maybe we shouldn't smoke"? Well, there were a good number of people who stopped smoking, but if you are a smoker or were a smoker, you know how hard it is to give that up. And in a sense, perhaps the success of this was not getting people to stop smoking. It was to get people to not start smoking in the first place. So the sort of lesson here is that these kind of public health campaigns require lots of money and lots of persistence. And some, I think, like cigarette smoking, require both generations and a change of social norms. I mean, if you told a 20-year-old that it used to be when you were in an airplane, everyone would be smoking, they would be horrified. They wouldn't believe that such a thing actually would have existed. And so the success here is, in a sense, not with the people who were smoking in 1964, but the people who were born after that, for whom they didn't see commercials on TV. They didn't see people smoking in public, in bars. They didn't see people smoking in airplanes. And so the social norm, if you will, changed from smoking is what sophisticated people do to smoking is what you have to do outside in an area not around anybody else. So with that, Jamie.
Yes, sir. Thank you. And so For us, where this one differs from the second example is getting ahead of the curve and teaching the right behaviors before they start. And I know what we have on the slide, but I'm going to take the moment to share a proud dad story instead, because my kids are now in their late teens, one in their second year of university. I won't name what because we have too many academics on the line. But when they were growing up, and I was being very careful to protect their cyber identity so they could get to 18 with a clean slate. Well, what you do at 18 is yours, but until then, it's my job to protect you. And all I got was, well, what do you mean I can't have this account? Or what do you mean I have to use real passwords? Or, why are you over my shoulder on this cyber engagement social media thing? What could possibly go wrong? But sure enough, as soon as the oldest one gets to freshman year in college, they're calling me saying, can you believe what my professor tells me is a secure password? It just needs to be 6 characters and they don't care about the rest. Or why do I need to go enter all my private information into this website just so I can get my homework? Dad, I don't want to do it. And so it took about 14 years of abuse of being the angry dad or the bad dad who forced them to think about these things in advance. And now they're coming to me and explaining how the rest of the world around them isn't secure, and don't these people know better? And so Doug's right, and very much right with the example. The educational opportunity to get them to never start smoking in the first place, or in this case, understand that there are risks, understand that there are standards and there are choices to be made, and not just look at a website and say, oh, well, you want my social security number so I can have a chance at a lottery for tickets? I'd love that. Here's my social security, my address, and my date of birth. Why would I not give it to you? And that is being taught in the schools, and some of those lessons are sticking, but it's a never-ending game, because every time we evolve and tell them, here are the things you shouldn't do, something like generative AI is going to come along with behavioral profiles and be able to figure out who Aristu or Yuri is without either of you being in the room, because somebody had enough of your information. And so we'll see this proactive approach to protecting your identity and information evolve over time as well. But in terms of getting to the community and getting to the future users in advance, to at least let them understand your actions today have impacts tomorrow.
Thanks, guys. So a couple of things come to mind sort of as I think about those from a high level. One is that you saw we've tried some of these things in cybersecurity before. I think we were able to look sort of back in history and say, yeah, these different methodologies, mitigations look similar to, for example, trying to just take away the bad thing, like the Broad Street pump, like just don't let people make the wrong choice, or let's try and develop good habits so that people don't start to do that. The fact that we could do that sort of in hindsight, I think, is just fortuitous and not deliberate. And what I would encourage people to think now about is, are there other things in those categories that we haven't tried or haven't thought about that maybe also fall in and might lend themselves to the kind of success that it did in public health? Don't know that that's true or not, and we don't have a laundry list of just like brainstormed ideas, but I think what we're encouraging people to do is not necessarily just look backwards and try and categorize, but to look forward and try and come up with new ideas. The other thing that strikes me as a little bit puzzling is why the examples in cybersecurity somehow intuitively feel less successful than their public health counterparts. I don't know all the reasons. I'd love to hear people's sort of feedback about that. But the fact that we've tried to do cyber hygiene in terms of like password health doesn't just feel as successful, and maybe it's too soon, as, for example, the campaigns against smoking. Maybe we're doing it wrong. Maybe the distinctions of the analogy have broken down in a way that is sort of notable there. The last thing that I'll say is that Doug and Jamie and I have been thinking about, well, what are the other methodologies that the public health community that's been around for 100 or more years has been trying to apply, and they remain very active. So cybersecurity is 50 years old. Public health is at least twice as long and arguably thousands of years longer. what is that public health community doing to think about sort of the holistic view of the problem? They have technology as a piece, and people as a piece, and equity as a piece, and funding and education. The color wheel is one methodology for thinking about this. There's a few people in cybersecurity who have proposed methodologies. One that Doug found for us that we've been sort of noodling on a little bit is called the Hadon matrix. Happy to talk a little bit about that. But if there's other public health methodologies that you all know about, I think that would be really interesting to figure out. Have they been tried in cybersecurity? And whether or not they have, why or why not? And is it something that we should try? Lots of people, including all of you, have thought about this relationship between public health and cybersecurity for a long time. It isn't really clear to me why it hasn't caught on more. Like, why is it not sort of grabbing the attention of practitioners and researchers, maybe in the way that I think it should? It feels like it is motivational enough. Curious to hear some more perspectives about that. So that's what we had prepared. I see a couple of things in the chat, and we'd be happy to otherwise just open it up for some questions.
So thank you. That was really interesting, and I have a whole bunch. Yes, and Yuri, who, by the way, it's 4 a.m. because she is in Japan. So thanks for being awake. But I have a whole bunch of places I want to take it, but I want to start with the one you were closing with, which is the Hadon matrix, which is something I haven't heard of, and so maybe others haven't heard of it. Could you share something about it?
Yeah, Doug, can you talk a little bit? You were the one who found it for us. How did you find it? I'll put up here, when you're ready, an example screenshot.
Yep, go ahead.
Okay.
So,
okay.
Well, and again, I'm an economist, not a public health historian, not a public health expert. So I was trying to find what other methodologies are out there, and just stumbled on a book by David Hemingway called I don't know if you can see it. I don't think, probably not. No, it's bad lighting. Called While We Were Sleeping: Success Stories in Injury and Violence Prevention. And the idea here that he was talking about, and by the way, Hemingway is actually a public health economist at Harvard. And he sort of inadvertently stumbled on the use of behavioral economics in injury and violence prevention, with the idea that perhaps we can prevent injuries by not even using and engaging the individual. We may not. Let's not start by telling people to be safer and to not be stupid, but rather build environments in which, even if they are stupid, even if they do stupid things, even if they're not paying attention, the injuries will be avoided or are mitigated. And he talked about something which then I found out is famous certainly in the injury literature, and that was called the Hadon matrix. And Hadon was William Hadon, or Hayden, was director of the National Highway Safety Bureau in the Department of Transportation in the 1960s. And he wrote an article in the American Journal of Public Health and came up with what has now become known as the Hadon matrix. And it's a 3x3 matrix, 2-dimensional, that has 2 axes. The axis on the left, the y-axis, is the phase of the injury-causing event, and on the x-axis is the sort of components or instruments of the event. So, what could be done pre-event, event, and post-event to either reduce the probability of the event or to mitigate the problem, the injury? And then there are 3 vectors, or 3 components of what could be used to reduce it, and that's the human factor, the agent of injury, and the environment itself. So in his example, so what could we do pre-car accident to prevent, or what are the causal factors that are causing these injuries? And for the human factor, it's they're inexperienced, they're distracted, they're incapacitated, they're drunk, they're high, whatever. In terms of the agent of injury, which would be the automobile, that the vehicles are not designed to avoid accidents, that they don't give enough information to the driver to anticipate an accident. And then with the environment, that the roads were not designed to avoid accidents, and there's poor street lighting and such things. And then there's a second related matrix. These were the causal factors. The next matrix, and Josiah, if you can click on that.
I don't actually have a slide with.
Oh, you don't have that. Okay.
Sorry.
So that's our. So then you think about, well, what are the countermeasures? And I've got mine here. So on the human factor, is you have a minimum legal driving age. You do random breath testing. You have graduated driver's licenses. So the people start with learner's permits, and then they have their ability to drive on their own. For the vehicle, to reduce the probability of event, is such things as mandated third brake lights. That is not just the brake lights that are on the side, but the ones that are on just below the back windshield are that. And with the environment, it's such things as building in speed bumps and roundabouts and red light cameras and rumble strips that are in which the road now provides information to the driver that the driver is not driving well. So I think the interesting thing about this matrix is that you can use it to identify and categorize the causal factors for, in this case, vehicle accidents, and then use each cell there to think about, well, what are some mitigating factors? And one of the things that we've been thinking about is, well, let's translate that to cybersecurity and think about the different potential issues within cybersecurity and how can we use this. And so phishing, for example, so you can use this use this matrix to set up, well, what are the causal factors for phishing, and then have a related one is what are some countermeasures to reduce the probability of phishing, reduce the probability of harm once the phishing attack has occurred, and which of these involve the human, the email, and the overall environment. So that's kind of how we're thinking of using that. That was a long answer to a short question, Adam. Sorry.
No, don't be sorry. I had recently been to an event at CISA where Bob Lord kicked it off with a discussion of Unsafe at Any Speed, which was Ralph Nader's book on the Chevy Corvair and how it was unsafe. And he traced out a lot of the history of how that book triggered events like the creation of the National Highway Transportation Safety Administration. And so I think it's interesting that you're coming to this from a related perspective. And this is a tool that I haven't seen, but it reminds me of an episode of 99% Invisible, which is 100% focused on that bottom middle box of the lack of post-accident analysis. And this episode traces the history and creation of accident report forms, which police officers use to capture what happened, which feed into a whole apparatus of analysis and improvement. And so one of the things that, and those of you who know me know this is a little bit of a hobby horse for me, is root cause analysis and the capabilities that we have to measure things about human health are just way, way better than the capability to do this in cyber. And as a current example that's on my mind, might be on other people's minds for various reasons. I learned yesterday that Chinese hackers that broke into Microsoft stole 60,000 State Department emails. Some of you may have had that information for slightly longer, but it's now publicly stated. So talk about at least the public statements. But more seriously, we have these super high profile events and we don't know what the heck is happening, right? We are playing at the blind person and the elephant, and I think it holds us back a lot. I can keep going, but I want to make space. I know, this is Alex's first time here. This is Rory's first time. I see some other folks, and so I want to.
So I'm happy to jump in. So I think, maybe somewhat predictably, if you kind of saw my NDSS talk, I think one main difference that I see between the public health examples and the cybersecurity examples is that the public health examples all were rooted in and driven by outcome measures, right? So we monitored, or sorry, not we, but Jon Snow monitored the incidence of cholera, right? Not Jon Snow, sorry. Or was it Jon?
Yes. It was Jon Snow, right?
Yeah, Jon Snow, right? Same with polio, right? Like we monitored the kind of the fatality rate and just the incidence rate from polio. For smoking, the success wasn't necessarily measured in the drop in smoking rate, but in drop in fatalities and complications from smoking. Right, that's the ultimate measure of outcome. As Adam, as you kind of alluded to right now, we don't have good sources of those outcome measures in cybersecurity, right? So we can measure how many people adhere to the password policy, but we don't know what it means in terms of overall reduction in losses, right? And that's like, again, kind of, the analogy in public policy would be, this would be like measuring how many people wash their hands without actually paying attention to the resulting decrease in foodborne illnesses, right? Anyway, so that's, that I think is the big missing piece for us.
Yeah, you've thought about this more than all of us combined, I think.
Not sure about that.
I was at an event yesterday with a bunch of people in the cyber insurance industry, and I will tell you, they are thinking about that, but they probably think about it differently than us, right? They think about claims, they think about dollar loss. They're not yet thinking about human life loss because they haven't had to in their cyber insurance policy. They might have to at some point. But we might think, even in phishing, about like credential compromise. Like, what is the impact of your credentials getting stolen? I think an actuary might put a dollar value on that. And it's something that we could measure the change in, at least, right? We could deploy some countermeasure and say, well, credentials are lost less often, and maybe that's a measure of success, possibly.
I think... So maybe I think I'm still concerned that it's not really the outcome measure. It's kind of like measuring maybe like, okay, how many, are more cars with seat belts? Not necessarily does that result in fewer fatalities and car crashes, if that makes sense. It's because maybe we have a way of limiting losses that does not necessarily result in fewer credentials being lost, right? Like, we're assuming that there is some correlation between harm and credentials being lost, but we haven't tested that hypothesis, right? Like, and it's a reasonable assumption. I'm just pointing out, but at the same time, we should remember that it's still an assumption that hasn't been tested, right?
And I wouldn't beat yourself up too much on that. Healthcare's got the same issue of, we build lots of hospitals. We have people admitted into the hospitals. Does it really make a difference? And back in the 1980s, Alvis Donabedian came up with a model of a three-part model in terms of measuring quality. I mean, how do you measure quality? And he says the first thing is just look at structure. Do we have QA committees? Do we have methods by which we are things that will enable us to reduce harm and or improve quality? So structure is the first one. Process is the next. Okay, we have QA committees. Do they actually do anything? And then the third part, which is the hardest part, which is what you're looking for cyber, is outcomes. I mean, we have a QA committee. Yes, it meets 4 times a year. Has it reduced? Has it reduced mistakes and errors and deaths in our hospital? What you really want to measure is the errors and actually and the deaths.
Yep.
Right. But it takes, instead of, in addition to wooing or woe is us, we don't have that measure. Go back and say, all right, let's start with, we're going to get the structure, then we're going to measure process, and then while we're doing that, we can develop. Our ultimate is to develop the outcome measures. So.
And I think that's so I want to be careful there. I think there's a stronger claim of of causation there, right? And I'm saying even without that, like even if I don't know which specific thing caused the better outcome, but for public health, like we do have the overall mortality data, right? Like we do know the age distribution at which kind of people die, right? And we can monitor that, and so I use the analogy with cars, right? Technically, we may not even know what specifically made car driving safer today than it was 40 years ago. And to some extent, we don't care, right? Like whether it's safer cars or we're just better drivers, right? The point is that, like, in the end, the outcome is better, right? And we don't have that for cyber, right? Like that kind of overall systemic look of just, how many lives and dollars are being lost every year due to poor cybersecurity, right? And I think that's having that feedback loop is essential in any scientific field.
Right.
So I would go step in I wouldn't say further, but different direction, right? In the examples we gave, there were measurables, as you pointed out, and I would say that in cyber we could come up with similar measurables. Whether on local or global scale is questionable depending on where you get to look at the data, right? If I get to compile the 7 major ISPs across the United States, I could get some pretty solid data if they'd all give me access. Or if I was just running my home network, I could accumulate the equivalent of the Broad Street pump, how many of my devices got infected. Where I think both healthcare and cyber are still going to share the problem is healthcare has a measurable, but is it the doctor's measurable, or the insurance company's measurable, or the Surgeon General's measurable, or the World Health Organization? Whose measurables really drive the implementation of these solutions? And in cyber, that gets even worse. One of Josiah's and my former colleagues used to say, you won't really see cyber reform until some of the insurance carriers get hit so hard they're paying out big dollars. And then they'll decide what matters and what they want to monitor. And that was just one perspective on it, because clearly insurance carriers matter and they have a level of influence over the user base, but the government agencies protecting the DIB have a different type of influence. The ISPs for private citizens have a different type of influence, and each of us care about different parts of the infrastructure. And while we can all measure number of infections whether it's from a specific vector of attack or just overall DDoS attempts of any type, we all probably care slightly differently enough to make those measurables hard to accumulate as a community across the spectrum. So in some sense, I'm trying to agree with you, even though it sounds like I might not be. It is the measurables, but then it's also which measurables and for which problems.
So I want to shift for just a second because Alex had to run, and I'd like to ask each of you, and I can't give you details yet, but I would just like to ask each of you to pencil January 9th into your calendars because you're all interested in this topic. We've got some interesting announcements coming up, and I was going to mention that before everyone left. I couldn't. So I want to interject, but so with that, yes, let's keep going. I just broke the flow. So I'm actually going to respond to something that Jamie said. Oh, Rory, were you coming in?
Well, I was just going to say, and this is maybe a bit of a slightly different track, but I was struck by the smoking analogy and how there was that landmark moment with the Surgeon General's report. And we're sort of missing that. Now, of course, that's more relatable to people when they're ingesting something and you tell them it's bad for them, they can understand that. But at the same time, it feels like in cyber, we've had a bunch of small landmark moments, but never that one big thing where the information was released at the same time where people were willing to accept it and sort of take it in and change. Obviously, even in the case of smoking, change was slow. But they met that report and the actions that came after it managed to overcome or defeat the marketing and the efforts of the purveyors of the poisonous things, more so than we've managed to have in cyber, where people still continue to do silly things online, in part because the vendors and social media sites and everything else encourage them to do terrible things.
So I wonder what it would take. Like, what would it look like if there was that in cyber, right? So if I think about like MFA, industry, researchers, the government, they've all said there is indisputable proof that turning on MFA makes you safer. And
Yep.
people don't do it. Like, what is it going to take? What is the Surgeon General's equivalent in cyber?
And I don't know that I have an answer, but I know relatability is part of it. User experience is part of it. I have some hope for passkeys, maybe that things like the user experience will be so much more improved, even compared to username and password, that people will actually do it. So that's part of it. I also wonder if it's just not pushed enough by those who provide application services, everything else. I know certainly within the software development community, which is where I come from, developers often don't care, right? Even developers coming out of universities and everything else, you have to beat them over the head with this stuff before they actually relate the potential harms to the people they care about, their own customers, for example.
So can I go back to what Josiah said just a second ago without disagreeing with anything? The first thing about the Surgeon, literally, the first thing about the Surgeon General's report is that there exists a Surgeon General who can issue such reports. And we lack someone with equivalent stature and the organizational charge to improve the health of the population, right? I think the closest we might have is Jen Easterly, or maybe it's Chris Inglis, or maybe it's Ron Ross, or maybe it's someone else, but we don't have, I don't think we have someone whose job is to be our Surgeon General who can issue such reports and create a prioritization.
Yeah, I mean, it might be those people, if they are seen as the authoritative source, right? Part of the fact that the Surgeon General had an impact is that people respect that role, right? And they see that as the definitive source of information. And if the Surgeon General says, well, then it's, to most people, it's truth. and we're going to do what the Surgeon General says. I think that is the next step. Like, yeah, you got to have that person, and then they have to have credibility.
Yeah, I think another thing I was actually thinking about this as Jamie was speaking, is it took from no, and it's not only the Surgeon General's report, but there was also a longitudinal study of British doctors which took place at the same time, which was so compelling that they stopped the study because the effect of smoking on doctors' lives was so visible. But even then, the difficulty of cessation was so high that it sort of didn't have an effect for 20, 30 years. And so Jamie was sort of bringing up why aren't we being as effective? And I might even argue that we are being precisely as effective as the anti-smoking folks, that over 20 years, we've done a pretty good job on buffer stack smashing buffer overflows. They're way harder to find than they used to be. And so should we be like, oh, these other folks have it down and we don't? That seems maybe giving ourselves less credit than we deserve, but maybe a good motivator. Doug, do you want to talk about this hyperbolic discounting point? That's really interesting.
Yeah, forgive me for bringing in behavioral economics, but that's who I am. So, so standard economics and sort of everyday life, you realize that people prefer things now versus things in the future, right? What behavioral economists have said is not only do they that, people really, really, really prefer things in the present than the future. So if MFA is slowing me down of getting to do what I'm here to do, with the promise that if I do MFA, that I will potentially be safer with some sort of probability, and that safer is often to the future, and it's also an uncertain probabilistic benefit. And so unless you can convince me that I'm really going to benefit by having MFA, that slowing me down is going to make me better off, I'm going to resist it. And I'm certainly not going to do it voluntarily. So,
well, that's interesting, because of course one of the other contributing factors to reducing smoking was the government's taxed the crap out of tobacco.
Right.
And so the cost came from the other side.
Right. And that's in part why I think what we've seen is that smoking has gone down, not because because fewer people are taking up smoking rather than people are giving up smoking. And that also means it takes a long period of time for that to happen.
So I was curious, I asked these insurance folks yesterday, like, why aren't my insurance rates lower for cyber insurance if I have MFA? Like, there's all this evidence that says that it's better. And I was shocked that it is like, none of us are going to do it unless all of us do it, because it's more work for the insured, right? If you get the option of 3 companies and only one makes you do MFA and they're all exactly the same price, you're not going to pick that one unless they can charge you less money. And that was my point to them, is why don't you know that causes less claims and less money? And they said, we don't know.
Which also sense that you make an explicit discount. I mean, insurers will, especially like auto insurers, will give you discounts for doing different things. Even if you're a non-smoker, they'll say, okay, well, that means that you have less probability that you're going to have an accident. And so they give you explicit discounts. I mean, Allstate does for me, and tells me that. Now, if they did even more salient and said, Josiah, your insurance premiums are $1,000 a year. They can be $900 a year if you use MFA. That means that now you have a salient, obvious benefit of using MFA, as opposed to if you use MFA, the chances are less that you're actually going to be hacked. So.
But I agree with everybody here that like these levers, people are not going to do this stuff on their own, right? If there's a lever which is a tax or an insurance requirement or some other lever, like that gets a lot of things done. Jamie, you're muted.
The thing said, if I held my space bar, it would temporarily unmute. Clearly, I should not be in such, a group of people who know how to handle technology. I'd also point out that there's a lack of trust from some people because MFA doesn't have a common understanding. It is being implemented differently by various providers, which leads to distrust on the part of the users, right? I convince you to do two-factor authentication, which has the token that Rory talked about. But then somebody else comes along and says, well, I'm going to do multi-factor, which is better than two-factor. And by the way, you don't even need the token, which makes me now, well, which one of my providers do I trust? The one that told me 2FA is the ultimate, or the one that tells me MFA is better because I want to do the best, but now one of you is lying to me.
I think the question of why don't the insurers have this data to the point where their greed overcomes their reticence, right? In theory, if I know that MFA is really effective, and I can go from charging $1,000 a month to charging, say, $800 a month at the same level of profitability, I can make a boatload of money by charging you $900 a month, taking the business from all my competitors and still having a higher profit rate. Right. And I'm embarrassed to say this in front of an actual economist, but I hope he's not.
So I have to admit, this is exactly why I went to Doug in the first place, because we're all talking about this from a logical, rational user perspective and what a business model using risk calculus would tell you the right answer is. And I read Doug's book. Now you have to all go read Doug's book. And I read Doug's book. Look, Doug, that's 6 more royalties you're going to get. That people don't behave the way economists predict them to behave when it comes to their own selves, right? As a global economy, you can expect certain behaviors because of efficiency and optimization in business that are looking to do profit. But as a single, all of us are, each of us is smart. All of us are not. There's a despair.com about that somewhere, right? None of us is as dumb as all of us, or something like that. Anyways, as individuals, we don't apply the same rigor and logic. We have a huge wealth of variables that influence our decision making, which is, correct me if I'm wrong, Doug, this is where behavioral economics comes in to say you can't use straight up logic and reason to predict how the user will react to these influences. And in fact, I'll go a step further. Doug, I'm sure Doug knows the name of this one. I hate to put you on the spot, but there's a classic psychological effect where if I come to you and offer you A versus B, you'll make a choice. And so the example they gave is, tonight for dinner, we have apple or cherry pie. And so the customer says, well, I guess I'll have a slice of the cherry pie. The waitress returns a minute later and says, I was wrong. We have apple, cherry, and rhubarb. And the customer says, oh, well, in that case, I'll have the apple.
Right.
And so marketing firms use it in a very obvious way of, if I offer you something for $100, you'll say no. If I give you a choice between 110 and 100, you might say yes to the 110. But if I offer it at 180, 110, and 100, you're going to buy the 110 every time because it looks like I've given you a huge discount from the next step up. The actual one I'm talking about is completely, it's unpredictable the way people will change their minds when the third option is introduced. And that's where individual behavior trumps economy and economists.
Hello, everyone. Sorry, it was a way too early time for me to speak, but I tried. This was fantastic, fabulous, conversation. Thank you so much. I learned a lot. And there are a couple of things I put in my text, but relating to what we just discussed, I'd like to point the cyber belief model, that how we can, it's Adam put a great technical paper. Like, we look at the health belief model, what kind of factors influencing to the people's changing behaviors for their health. And then there's 4 factors. I think Adam can explain a lot, but more deep, in depth. But applying that to cyber, I think we have really interesting, findings that we might be able to, do some interesting analysis, applying that long-lasting model. And then, throughout all that discussion, we talked about the metrics and data-driven. That's what we are super interested. How can we bring more data-driven analysis, like a normal traditional science field in cybersecurity? So that's one thing. And then when I put the link to the paper, super excited that we may be able to do the quantification model, applying the quantification model to that. So love to continue talking about that. One thing that throughout this session, I've been thinking what is missing in cyber is public health is about risks to others. It's about a population level thinking, and then identifying the risk factors that harm to the population or society, and then changing people's mindset that what you do, this mitigation, is not just to yourself, but protecting the infrastructure or protecting their overall system. And I don't know, that's to have seen what mask debate over the COVID time and the pandemic, how it's really influencing to the people's behavior. But I think it's the time that we should start advocating about the cybersecurity is not just about protecting you, but protecting overall, others, and then the community. So that's and then I have lots of questions to discuss. I really have lots of discussions. I put, like, how can we build the systemic infrastructure to collect those vital data? How can we develop the cyber vital statistics? How can we collect, because unless you have that population data, how can we measure and analyzing the mitigation effectiveness? How can we really, these diseases are outbreaking? All of those things, we need a vital statistics in cyber. So we started some studies. One of the challenges technical, aspect, but the other thing is more institutional aspect, that how can we build the global institutional mechanism to collect data like vital statistics in global. That's one thing. So many things, but I'm so excited. This is like a dream. Is that a really dream? Oh, boy. This is a fantastic team. Thank you so much. It was worse to wake up 4 o'clock in the morning. I can't wait to meet you all in January in person with this workshop. This is fabulous.
Yes.
Thanks for having us and for all the great ideas and questions.
You're welcome. And Arastu is nudging us to remind you that next month, October 26th, Dr. Irving Lachow will present on lessons from the evidence-based medicine movement. So we'll be sending out a link about that. And, we really want to encourage people to continue thinking about these things, can build out some collaborations. And so if you didn't have a chance to cross-connect in messages as people were speaking, please hit me up. I'm happy to make mutual introductions to keep the conversation going. And so with that, thank you all so much for your time today, and we'll hope to see you both next month and on January 9th. The full details of that will be coming out as soon as we can, I promise. So thank you to Jamie, Josiah, and Doug, and everyone.
Thank you.
Thank you.
And
Thank you so much.
Thanks for the
Fantastic.
opportunity.
Cheers.
Appreciate it.
welcome.
Bye-bye.